This interview is sponsored by Santon Canada Incorporated as part of their ongoing commitment to eye care. October is Children's Vision Month, and today we're talking to Dr. Stephanie Dotchin, a clinical assistant professor at the University of Calgary, section of ophthalmology, where she is also a pediatric ophthalmologist. Welcome to What She Said, Dr. Dotchin.
Thank you. I'm
So,
happy to be here.
So I was hoping today we could talk about some of the most common vision problems children experience. So I think a lot of parents will come up against conjunctivitis or pink eye. So how do children contract that? That seems to be the most common.
Yeah, so conjunctivitis or pink eye, most commonly people will think of as an eye infection, which is probably the most common way that you can get it. So spreading just like the common cold, you can pick it up from other kids easily. But there are other reasons that kids can get pink eye that aren't due to infection. Some things are a little more rare, something kind of like allergy or something called vernal keratoconjunctivitis or VKC. We call it for short because you trip over your tongue when you're trying to say it, just like me.
So pink eye then is not necessarily a virus.
Not always. So oftentimes people think that pink eye is, uh, a virus, but there are lots of reasons for pink eye. Pink eye just tells you that the eye is pink. It doesn't actually tell you the actual cause of why the eye is pink.
Okay, so let's talk about some more other common eye issues then that children might come up to. One that I remember from a childhood friend of mine is lazy eye. So
Mhm.
how is that? Are you born with lazy eye or does it develop?
Yeah, so lazy eye can mean many things to many people. Most people think of a lazy eye as an eye that is weaker than the other. And you can develop that from many different ways. You could be born with it, like you said, like if you had a cataract or something. You could get a lazy eye if, say, you have undiagnosed need for glasses. So then the eye can become lazy. Or if you develop an eye turn, the eye can also become lazy.
So it's one of those things because a friend of mine, like I said, she had it as a child, but then it was corrected
Mhm.
through, ongoing appointments with her ophthalmologist, obviously. Okay. And so what about nearsightedness? I feel like that's probably a big one as well.
Yeah, so nearsightedness is very common. So what nearsightedness is when people have a hard time seeing far away. So it's the exact opposite of what you would think. And again, so what you might see is your kid kind of squinting to see in the distance. They may stand really close to the television, or they may say that they can't see things as well. And so for that, we typically just put kids in glasses.
Okay. So that's fairly straightforward.
Fairly
Uh,
straightforward, yeah.
all right. And so I guess the biggest one then is eye allergies, which can be experienced throughout the entire year.
Yes, yeah. So eye allergies can present like a pink eye, and people will think, "Oh, it's just an infection." But the problem is it doesn't tend to go away without someone actually looking after the eye and treating it. So compared to, say, a virus, these kids will rub their eyes a lot. They'll be like sometimes they put their fist like right in really deep. They may complain that they're light sensitive. They'll have lots of tearing as well. So yeah, allergies are actually a lot more common than people realize for sure.
And so do allergies, though, if left untreated, can they have an effect on vision?
Yeah, so if you look at some type of allergy, so like I said, like a VKC, for example, this can actually go year round. And what can happen is the kids, because they're so itchy, they rub and they rub, and they can actually rub off the surface, which of the cornea, which is that clear window of the eye, and then that can scar, and it can actually compromise a child's vision for sure. Yeah.
Okay. So last question, because I feel like this is a very important one. A lot of kids' screen time has increased dramatically,
Mhm.
and that has to have an effect on vision. So what is there any preventative steps parents can be taking to protect their child's vision with all this increased time on the screen?
Well, especially because of COVID, we've seen a lot of increased screen time, kids going to school. And I've actually seen a lot more kids with symptoms in my office actually related to that. The most common thing is kind of like a dry eye. So the eye can appear pink, it can be irritated, they can have tearing. And so I give the simple rule to start with of the 20-20-20 rule. So look at the screen for 20 minutes. then look away for 20 seconds at 20 feet. So you don't actually have to get up and leave the screen. So if you're at class, but you should just break that contact, because when we're actually on the computer screen, we don't blink as much as normal. If that isn't enough, you can try artificial tears and warm compresses. And if it's even worse, then you probably need to see your eye care professional just to have an assessment to see if there's any additional things we need to do.
And is there any benefit to having like a blue filter?
So interestingly, so some people recommend the blue filter, but there hasn't been great evidence to suggest that children need blue filter glasses to reduce the blue light, or that has an effect, because that won't change the blink rate and the eyes drying out. And they say that actually if you go out in the sun, you get more blue light than you do from a computer screen. And we know that being outside is a good thing. So,
Okay. So basically then get to see your eye doctor.
yeah, if there's a concern, I would say, yeah, see your eye care professional for sure.
Okay. Thank you so much for joining me today, Dr. Dotchin. Have a great day.
Yeah, you too.